Good afternoon. I'm calling to order this meeting of the Health, Environment, and Community Engagement Committee. My name is Cam Gordon, and I'm chair of the committee. And today I'm joined by Council Members Bender, Johnson, and Kano. I suspect Council Member Glidden and I know Council Member Fry will be arriving shortly. But I think we better get started. We have a fairly lengthy agenda, 7 items. 4 of those are discussion items. But we also have 3 consent items, so I'm going to move those consent items first, and then we'll move right into our Cradle to K draft plan presentation and discussion. The first item is authorizing execution of a contract with the Minnesota Department of Health to accept an estimated revenue of $2.8 million to implement community and clinic-based strategies to prevent obesity, diabetes, heart disease, and stroke. The second item is authorizing execution of a contract with the Minnesota Department of Health to accept an estimated revenue of $742,000 for home visiting services for women and young children. And the third item is approving the City Council appointment of Jan Auger for a 2-year term to expire December 31st, 2016 to fill the Hennepin County Human Services and Public Health seat on the Minneapolis Public Health Advisory Committee. If anyone wants to pull any of those items off to discuss them, we can do that. Councilmember Fry.
Mr. Chair, I don't want to pull anything off, but just had a quick question. Item number 2, maternal and child home services, is that in conjunction with the Cradle to K initiative as well, or this is a separate item that's been ongoing?
Well, this
doesn't make any difference to me. I was just curious.
It's an ongoing effort, but incidentally, something that's recommended to continue and increase through the Cradle to K, so it is related.
Thank you.
All right, seeing no further discussion then on those 3 consent items, all those in favor say aye.
Aye.
Any opposed? Those items are approved. So now we'll move into our first discussion item, which is the Cradle to K draft plan. And I think we'll let the mayor introduce this topic, and then we'll move on from there. Welcome, Madam Mayor.
Thank you very much, Mr. Chair. Thank you to you and the members of the committee for allowing for this presentation today and for allowing me to say a few words. As folks know, one of the things that has been a priority for me and one of the things I came in to this office wanting to do was make sure that we were addressing the needs of our youngest Minneapolitans, age 0 to 3. Often when people talk about early childhood and early childhood education, they're talking about kids age 0 to 5. Often that's a focus on 3 to 4-year-olds and making sure that they're ready for kindergarten. But that 0 to 5 age range is not a complete, it's not a monolith. It's not one set of issues for the entire 5 years. That in that first 3 years, prenatal, actually, not just 0, but like prenatal to 3-year-old, that is when 80% of brain development happens. And that adequate brain development sets a kid up for capacity and ability long term, that what happens in early childhood matters. And those disparities, those racial disparities in that growth show up by 18 months. It's the first opportunity gap a kid faces is, are they born healthy and do they get the brain development that they need? And basically, are they best able to take advantage of the early childhood opportunities that they're being given starting at age 3? So I started an early intervention, getting kids some of the resources that they need at this very early age matters long term. In that Professor Sojourner at the University of Minnesota has done his research and showed that kids who got a certain set of interventions in their child care settings in the first year, that they did better than kids who didn't, that this was true for low-income kids, that their outcomes look like high-income kids, and that and the significant thing there is that those results persisted into grade school and anecdotally into high school, even if there were no other intervention for those kids. What happens in these early years matters. And so I created the Cradle to K Cabinet. It's a group of 28, 30 folks from around the community who've done work in this area for years, experts, to take a look at the 3 subject areas that you'll hear about in a minute. And I'm very, very grateful to them. These are some of the world's experts on these issues, let alone state or region experts on these issues. Some of them are here today, and I want to note them and give them thanks. Our own Gretchen Musicant, Health Commissioner, Anne Groot from the Youth Coordinating Board is here and sat on the commission. Mikkel Beckman from the Office to End Homelessness, Frank Forsberg from the United Way, and Sarah Klein, who was with Joyce and is in another setting right now where she is also useful on these issues, and Carol Miller from Hennepin County, also years of expertise on these issues. And I appreciate the service that they gave. So they spent months putting together a set of recommendations on 3 goal areas: every kid stably housed, access to quality childcare, and a healthy start. And those recommendations are out in the world right now. They're available for public comment. We're seeking public comment. We do have a couple public forums coming up, which we can give folks more information about, one this week. And so today is a presentation to you all and to the council to sort of lay out there what's out there, to get feedback, to get your feedback, to get your thinking and ideas on these draft recommendations, and to think about how we can move forward with the cabinet. So that said, I will turn it back over to you, Mr. Chair, and I appreciate a few moments to set up why this is important and what we're doing here today.
Well, thank you very much. I appreciate that. And I also appreciate the fact that the cabinet and that you have come up with a draft report, and you're now giving the community and the council and others an opportunity to respond to that and coming back with your final recommendations and your final report
Mr. Chair.
up ahead. Yes.
I apologize. There are a couple people I forgot to mention who are here. Carolyn Smallwood, who is co-chair of the cabinet with Peggy Flanagan, is here to give the presentation. And then Diane Halsey, who was full-time with my office, still working on these issues for the city and for my office, who did all the work to coordinate this, to make the cabinet happen, bringing her expertise, her relationship, and her capacity to get this pulled together. And I didn't want to forget to mention their great work and my appreciation for what they've done.
Well, on that note, why don't we call up then Ms. Smallwood and Ms. Halsey, or in whatever order you'd like, to begin the presentation. And thank you so much for being here and for all your work on this.
Thank you for having us, and thank you for having me, sir, and council persons. I'm going to start off with a few statistics for the city of Minneapolis first. 32% of our children ages 0 to 5 live in poverty. 27% of our children younger than 6 live in low-income families where parents are working. 1,230 children birth to 3 are homeless or considered highly mobile, identified by the Minneapolis Public Schools. 41% of Hispanics, 57% American Indian, 68% Asian, 70% African American children are ready for school compared to 91% of our white babies or white children. As far as reading proficiency, Minneapolis Public Schools scoreboard at the 3rd grade, 58% of white children are proficient, 38% of Asian, 21% American Indian, 23% African American, and 16% Hispanic. I tell you that the mayor is on to something with the 0 to 3 cradle to K. As Mayor Hodges indicated, that the cabinet was formed in the summer of last year, 2014. The cabinet is structured around 3 major goals. One goal, all children 0 to 3 have a healthy start. The next goal, all children 0 to 3 have stable housing. And the last goal, all children 0 to 3 will have an equal access to early education. The cabinet have been working very hard on these issues and have developed recommendations and indicators of progress for success for the mayor, and we'd like to introduce that to the council. Also in 2015 or late 2014, the cabinet did weigh in on 2015 legislative agenda with the city of Minneapolis, and now has some early education agenda items on that 2015 legislative agenda as well. As I indicated, over the last few months, the cabinet has been working very hard to develop these recommendations and indicators. And as a result of that, last month, we presented a draft of that plan to the public. And we're very proud of the work, but it's not done, so we need your feedback. During this week, we will have 3 open forums, March 3rd, and you're quite welcome to attend. Matter of fact, I think it's sold out already. As well as March 5th, we are going to be having additional parent conversations over the North and South Minneapolis, which we're very excited about. So we're looking forward to getting input from the community on these reports. Diane Halsey is going to start off with Goal 1. All children should be healthy.
Thank you.
Welcome. Thank you for being here.
Thank you. Thank you, Chair and council members. First I wanted just to talk a little bit about the structure of the report. I'm not sure if you all had a chance to read through it. I know it's a little long, so you may not have covered all of it, but just to give you an idea, what we wanted to do was to give a set of recommendations under each of those 3 goal areas that Carolyn just stated. And then within those, we have a set of strategies under each recommendation on how to move that recommendation forward. And the report also includes indicators of progress. So how are we going to measure, how are we going to know over a period of time if we're moving towards that recommendation, that goal? We've created a set of indicators. So today I didn't want to get into the indicators, but just to give you a really broad, high-level view of what our recommendations are in each of the areas. So we've kind of already gone over what each of the goals are. So I'll start with the first one, which really is around all children having a healthy start and making sure that they're having good, positive early experiences so that they can be ready for kindergarten with that reading knowledge and numeracy and good social emotional health. So what we kind of looked at, each of the subcommittees spent a lot of time surveying kind of what gaps were in the system and what alignments needed to be made in each of these areas. And so just to give you an idea, we're going to talk a little bit about what some of the issues might be in some of these areas. So under this Healthy Start area, one of the first one is early childhood screening. In Minneapolis, in 2013, only about 24% of 3-year-olds were screened. And it is recommended that children are screened at 3 years old, because when you're able to screen at 3 or even earlier, there's time there to provide intervention if a child shows a delay, so that they can receive interventions and then therefore be ready for kindergarten. But there's a lot of efforts that are happening in this area to make sure that children are screened, but we still have a lot of work to do. Our own health department has participated in a lot of efforts around making sure that children get screened. There's a project called the ABCD Project that's working really closely with clinics. And also Generation Next has heard of this as one of their main goals under their K readiness plan as well. So we just want to be, add our voice to the pot that this is an area that really needs attention. And the second area is under children's mental health. A lot of people may wonder, why would a child that young need mental health services or behavioral health services? And what we found is that many of our children, Carolyn mentioned the number of children that are homeless and highly mobile. There's many children, especially low-income children, that are facing high levels of trauma at very early ages in our community. And we have no plan for really how to intervene with those children, to provide services. There are some services, but not nearly enough, and no coordinated plan about how to really intervene. And so that is the area also we looked at. Then general health and development. The health department has been doing a lot of work in this area. A lot of home visiting happens through the health department. But even so, with all the work that we're doing, we are still facing really higher infant mortality rates among African American and American Indian women, but especially African American women, which is 40%, their mortality rate, infant mortality rate is 40% higher than our target. In addition, we mentioned the pre-literacy and academic development that happens in this age. And we have also found that new research from Stanford University has found that a gap as early as 18 months can occur. Now, this is a racial disparity gap that is happening as early as 18 months, and it has to do with the number of words that a child is exposed to. But this also relates, if you think of it as a continuum, our learning as a continuum, what's happening in those younger years is laying the foundation. We talk a lot about reading by third grade. Well, what's happening even at 18 months is laying the foundation for reading by third grade. And if we're seeing disparities already at 18 months in terms of what children are being exposed to words, it kind of shows you why then we're continuing to see that disparity of reading by third grade, which then ends up in the disparity even in high school graduation and beyond. So, having said all that, this committee worked really hard to develop a series of recommendations in this area. The first one is increased early childhood screening at age 3. The second one is to improve the mental health services of children birth to 3. As I stated, there's no real coordinated effort in this area. And the third one is around decreasing the word gap of children birth to 3, which I mentioned is that the gap that's showing up even as early as 18 months. Fourth is to expand targeted home visiting services to families that are at high need, and being able to provide them with services prenatally, even up until the child is 2 or 3. And lastly, to increase community awareness and engagement in the importance of early childhood development. We believe that a lot of times, there's a lot of times people don't really realize what happens in those early years and how important it is that we provide these extra supports to children at that age. And so being able to have and host community conversations where we're talking and learning about brain development, about attachment, about the word gap, is very important to increase our community's understanding of all these issues. The next goal that the cabinet worked on is making sure that all children are stably housed. And this may seem like an odd goal as one of only 3 goals for a cabinet that's working on prenatal to 3. But as you probably know, that it is very hard for a child to develop appropriately when they're not stably housed. When they're homeless or when they're highly mobile, this directly affects how well they're able to develop. So this committee when they began to look at what needed alignment in this system and where the gaps are, a few themes emerged. The first one being that we found that mothers that, when we're looking at who are repeat shelter users, emergency shelter users, those families that are in real need of affordable housing, it tends to be young mothers, 25 and younger, who have the youngest children. These are the families that are the ones that are repeatedly the most vulnerable in housing and repeatedly using our shelter system. In addition, those families that are needing affordable housing are the ones that are very low income. So these are families that are maybe making $15,000 a year or less. So this is way below even the poverty level that we're talking about. And these are also families that are repeatedly showing up in our shelter system. And lastly, while families are on their path to housing, if they might be homeless or in supportive housing, there really is no funding or services that target directly homeless children that in our state. There are many very dedicated providers that are kind of piecemealing some services here to there, here and there. They may get a grant funding for a year or two, and they try to run a program, and then that funding goes away. But there's nothing that's really targeted at supporting children supporting children that are homeless or even in supportive housing. So in this area, we had three main recommendations around getting families in stable housing. The first one is being able to increase housing options for the lowest income. So those are those families that are $15,000 or less. But here we say 30% of the area median income. So those very low income families. We need to be able to provide housing options, which means we need to be able to develop housing for families at this income level. Secondly, we need to be able to target funding specifically to address the needs of homeless children and families while they're on their path to stable housing. And lastly, we need to be able to provide resources for very low-income families to become economically stable. So the other part of this pie is families need to be able to afford their housing. So they need to be able to have a living wage job, or they need to be able to have a GED or whatever it is that they need to be able to provide the resources for their family to provide that stable housing. And our last goal, I'm going to let Carolyn take over on our last goal about continuous access.
The last goal is part of, as I call it, as part of the three-legged stool here. And this means continuous access to high-quality education. The gaps are so wide in early education at the particular time, especially when our families between the ages of have babies between the ages of 0 to 3, there's limited access. So what the cabinet did was, the gap primarily to affordable, high quality care for low income families is almost non-existent at times. And the primary goal here is to look at why are the resources are limited for low-income families day by day. And there's various reasons why. One, limited access to resources on behalf of the families that we serve. Two, lack of transportation at times. Three, lack of strategic resources to close the gap for early education when moms and dads are working toward jobs and etc. So in other words, if a child does not have a good start in early education, have access to quality, high quality access, that increases the gap long term based on research, as the mayor indicated, as well as other researchers like Aaron Sajoni has stated, that children day by day are not ready for school, nor are they ready for high school and beyond. So what the cabinet did was they looked at those gaps and made a few recommendations in order to close that gap. But prior to that, we really did have to look at what we call our family, friends, and neighbor care. What we're finding is that a lot of our children not only do not have access to early education, but a lot of them are being taken care of family, friends, and neighbors, which means that when you're taken care of by family, friends, and neighbors, you may have limited access to education in the home, which even broadens the gap of the situation that we're dealing with. So we have a two-pronged situation that's going on here. But as part of that three-legged stool, as I indicated before, number one, the child must be healthy, the family must be healthy. Stable housing is essential. Then you have the continuous access to a high-quality early education. So some of the recommendations that the committee came up with was, one, ensure that low-income families have access to financial resources to afford high-quality early learning programs. They need the resources in order to have these services. Some are available at the particular time. That we made major strides in the state of Minnesota with Governor Dayton, with scholarships, as well as services from other organizations. Increased the number of available high-quality childcare slots in Minneapolis. There's a big gap is there as well, where there's not a lot of what we call licensed high-quality early learning education facilities in the city of Minneapolis. So in other words, we have many children and many families that cannot afford, let alone have access to these services as well. Another strong point, recommendation, partner with family, friend, and neighbors providers to ensure that children they serve are prepared for school or prepared for kindergarten, which means that we need to bring resources into the family, friends, and neighbors. They need training on what early education looks like, which is very important. With that being said, though, in the early education area, we have to take a note and take a thought. These children and these families that we're serving are our next generation for the city of Minneapolis at the particular time. The return on the investment is huge when a child is ready for school, when a child graduates from high school and become productive citizens. Now I turn it on to Diane to close it out.
So we just wanted to give you an idea about what our next steps are after this report. As we've stated, this is our draft report, so we're having this period of what we're calling community input, and this is part of it, and so we're really glad to be here today to get your input. But we've, when we released the report, it went up on the mayor's website, and we've been getting comments from the community. People are welcome to go on there, download it, and read, and email us back comments, and we've been getting a lot of good comments that way. As Carolyn stated, we're hosting 2 public forums this week, one at Children's Hospital on the 3rd and on the 5th at Phyllis Wheatley Community Center. And then lastly, we've been inviting ourselves to parent conversations. So we've been working with mostly nonprofit organizations in the school, ECFE, as if they have groups of parents that are already meeting, we're inviting ourselves to come along and have more intimate conversations, you know, of about an hour or so, where we're asking questions about each of these goals and to get real good information about what works, what doesn't work, what are some of the challenges for parents, and they've been extremely helpful. And so at this point, I will just open it up and for any kind of questions or comments that you all have that we'd like to get.
Thank you very much. Councilmember Connell.
Thank you, Mr. Chair. So first of all, a comment and then a question. And the question is going to be around how we define high quality child care, or sort of that notion that you guys presented. So I'm really glad to see the language and recommendations around addressing low-income families, because those opportunities are very much connected to what families can afford to do, whether it's good nutritional choices, high-quality food, stabilizing your living situation does have a lot to do with what you can afford and where you can afford to live. So I appreciated seeing some of that, some of those economic justice lenses onto this work. I'm curious about what is the data or research or how this group has identified high quality childcare services or opportunities, because it seems to me that tends to be, based on the family, like what I would consider a high quality space and what somebody else may consider a high quality space, especially when it comes to things like, do you do a play-based curriculum versus a curriculum that's focused on memorization of letters and colors and numbers? So I'm just kind of curious, kind of what are we meaning by high quality, and kind of where are we falling on around those definitions?
Yeah, that's a really good question. And For our purposes, and especially how we have our system set up now, we're, in the report, when we say high quality, we're referring to our, a couple of things. One is our state has a quality rating system called Parent Aware. And so the highest mark on Parent Aware is a 4-star. And so when we say high quality, we're meaning a program that has received either 3 or 4 stars. Or a program can be nationally accredited by an accrediting body such as NACE, well, it stands for something. I'm blanking. Yeah, National Association for the Education of Young Children, or the Council on Accreditation. So there's accrediting bodies, and so we're looking at a program that has reached a higher standard. And in these standards, there is the issue on does the program have a curriculum? I mean, that's, I know, one of the standards, but there's many others.
Thank you.
Any other comments or questions? Councilmember Bender.
Thank you, Mr. Chair. Thank you so much for this work. I think sometimes these issues are overwhelming, and the fact that you've been able to take some of the brightest minds working on this and distill it down and prioritize goals is extremely helpful. As I'm reading through this, I'm thinking, and my mind is racing about which things are things that we might be able to directly implement and impact as a city. Some things we'll have to rely on our partners. I wanted to talk briefly about goal number 2. Something I'm very passionate about and have been working on a bit in my time here, particularly in my role in the Zoning and Planning Committee, which is where all children are stably housed. And Chair Gordon and I are working on revisiting our shelter zoning regulations, in part because the way we currently regulate them is very limiting and doesn't provide opportunity for us to look for creative solutions for homeless families. So I wanted to highlight that for my colleagues. It's something where even when we talked about bringing it forward, it was controversial, even the idea that we might discuss this issue. But it's so critically important, and I think often we forget that children who are living without stable homes are in our community, and they are members of our community. They are sitting in chairs in our school system, and they are in a part of our community and deserve housing and need housing. And so that's just one policy change that's before this council that comes to mind. But I wondered if you could elaborate a bit more on your next steps in implementation of the recommendations and how you might look through these and look at places again where the city could directly implement policy change, where we might rely on our partnerships, and where you see this moving forward.
I am so glad you asked that question. And I'm going to ask one of our cabinet members, Nicole Beckman, to come up and help answer that question.
That's why you kept looking at me. Good afternoon, everybody. It's nice to be with you. There are a lot of things out of the control of the city related to housing development. As you know, it's a very complicated business. There aren't enough resources typically to hit that real affordability factor, but there are a couple of things the city can do. So, Mr. Chair and Councilmember Bender, that's a great question, and we did discuss it and we did think about it quite a bit. There are a couple of things. The city by policy could really decide to focus their development dollars they do have at their disposal, like through the Housing Trust Fund and other mechanisms, to really focus on that 30% and below area median income population. Now, it is incredibly challenging for housing developers to provide multifamily housing for that population just because of the cost of land and labor and materials. But with the city's help and something like a Housing Trust Fund, that does allow for the development of those more affordable units. Right now, the city currently, I think, uses the bulk of its resources around for the 50% AMI population, which is also a need. Not saying it's not, but maybe for a couple of cycles of funding to really focus on that lower end might be helpful. I think if there's anything we can do around looking for, directing staff to find locations for the development of some of our public housing opportunities we might have in the city, that would really be helpful. I think that not being so, this is true of all in my limited experience of 25 years of looking at this. Not being, a lot of our funders, both at the city and the county and at the state, are somewhat passive in not really declaring to developers what your priorities are. And I think really coming up with a focused priority list for young families with very low incomes and telling the development community, we would like to see more of these units coming online in our city, in our community, might be helpful as well. So those are just a couple of suggestions. And then encouraging our other capital funding partners, Hennepin County with its Affordable Housing Incentive Fund, and clearly the state of Minnesota with its larger resources, with its low-income housing tax credits and its other programs for rental assistance, to really also everybody getting on board with that 30% and below AMI. And then really pushing hard and working in partnership with Minneapolis Public Housing. We do have a rare opportunity to actually create up to 112 additional public housing units for families. And those would come with permanent deep operating subsidies and property management dollars. What we don't have is capital dollars right now to support those, but those could be built anywhere in Hennepin County, in Minneapolis and in suburban Hennepin County. And with the right partnerships with public housing, I think we could see it's a great opportunity to hit those families that are the lowest income in our community. So,
Thank you. Councilmember Frye.
Thank you, Mr. Chair. First, I really wanted to applaud both the mayor for this initiative earlier this year that started, as well as the committee. I know you guys have been working very hard for really an entire year now, and obviously you've come forward with a very comprehensive proposal. I just have a bunch of questions. First is the word gap. I've heard about this a bunch before. I don't know what the exact gap is, though. I'm just curious as to the figure.
So the word gap actually comes from research that was done several years ago by professors Hart and Risley, and the estimation is that by age 3, I believe, that low-income children have heard approximately 30 million fewer words than upper-income children. And that's where the term, the word gap, comes from. And it sounds like a lot, but if you think about how many words you don't probably think about how many words you say a day, but it can be quite a lot. So that's a cumulative of how many words less a lower-income child may have been exposed to.
30 million.
30 million.
That's incredible.
And then sometimes it's actually referred to as the 30 million word gap.
Is that right?
Mm-hmm.
Second question, we're increasing the number of childhood screenings. The goal is to increase them. You mentioned they were presently at 24%, which was at 24% by the age of 3, which is actually kind of impressive to me. What's the goal of how many? I mean, obviously the goal would probably be 100%, but do we have like an interim goal by a certain date, or?
We've just, that's actually a really good question, Councilmember Frye. And if I remember correctly, I believe our goal is it 80%? 10% increase per year. Thank you.
Per year. Thank you. I'm going to hold off on that question until the end. But the second piece, as Councilmember Bender pointed out, goal number 2, I specifically applaud. I think that's incredibly important to find stable housing options. And, you know, I was, this is 4 or 5 months ago now, but visited a whole bunch of homeless shelters. And what I was most surprised about was to find, you know, the percentage of people in these shelters that were working. And working part and full-time jobs and really trying to make it, but because there wasn't an adequate amount of affordable housing there, they couldn't bridge the gap from homelessness to, you know, regular market rate housing. And the big question is to how do you deal with that? And then what we also noticed is rock bottom for all of these individuals was very low, but for women, and specifically women with children, I mean, it was a really, really rock bottom because, you know, at a certain point, a lot of them started with drugs or selling their bodies or major issues. So finding a way to bridge that gap and providing the 40 and 30% of median income housing is incredibly important. I guess the question, and this may be for Mr. Beckman, but how do we better facilitate that? Given the cost and the intricacies, and then my follow-up question is regarding Section 8. Section 8, which I think really has gotten a bad rap over time, but I mean, if you look at the statistics, it provided a whole lot of people with housing, and it put the money in the hands of the renters themselves. And I believe there was a law that prohibited municipalities from requiring landlords to take a Section 8 individual if they wanted to sign a lease, but I'm not sure we're allowed to do that.
Yeah, Chair Gordon and Councilmember Fry, great questions. There are a couple of other things. Well, let me back up. There's only two ways to make the math work when you're looking at housing affordability. All of us at some level struggle with affordability, and we all go out with the money we have to purchase housing in the marketplace. But really the only two ways to make housing affordable for people who are the poorest people in our community is to either lower the cost of housing or raise people's personal incomes. So raising the minimum wage, great way to raise people's incomes. And by the way, poor people spend 100% of their income, a great way to stimulate the local economy as well. Job training programs are a great way to give people the skills they have to go out and raise their own incomes. So whatever the city can do around job training and just getting those income levels up is great as well. Section 8, there are about 5,000 Section 8 certificates circulating in our community that people are using. There has been a cap on new Section 8s from the federal government, which has been in place for a very long time. And so competition for those is great. I think Section 8 vouchers have a bad rap. We have looked at properties where they're in use, and we don't see high numbers of police calls and nuisance calls and other things to those. And that, by the way, I would add that's true of our Housing First program for the very long-term homeless single adults as well. It's typically households that don't have a connection to either income supports or case management support where we see the problem calls and the problem property issues going on. And so whatever we can do to promote landlords and encourage them to rent to people with those, I think the city could have play a leadership role there as well.
So we can encourage. Are we allowed to require by law?
I would have to research if a city can do that in the face of. There have been some federal laws passed that are, I would say, anti-Section 8 coming out of Congress in the last few years, and so I would have to check on that and see if cities are allowed to do that. Clearly, you can add to the non-discrimination charter we have and include language around Section 8 holders as not being discriminated against, which would be a great idea as well, I think.
Thank you. And then my final question, I don't know exactly who this would be directed to, is, this is a very comprehensive study at this point. And it just regards to what's the funding mechanism to push a lot of these items forward. I think I read somewhere a couple of years ago that the cost per kid per year to do daycare was $10,000, so $10,000 per kid per year. I'm not sure if that's accurate, but regardless, how are we ultimately going to pay for all of it? Is it low?
Yeah. Councilmember Fry, I think this is one of the reasons why we're kind of having this public comment period, is to really kind of gather more information. And as you can see, this is a really broad report, broad recommendations, and there are significant resources that are attached to some of these recommendations, but we're looking for it from the community at large. So a lot of that funding that you're talking about, even for early childhood, would probably come from the state level. There's a lot of legislation going on right now around that very issue. Also, a lot of it may come from the federal funding. We get a lot of our home visiting funding from the federal government right now. And then the broader community too, as well. What kind of foundation support that we might have for some of these recommendations. So it's a good question, and it's one that I think in general we all should be grappling with, is how we're going to fund and support get the resources to move these forward.
Thank you.
Councilmember Johnson.
Thank you, Mr. Chair. I definitely want to thank our mayor and the cabinet for this incredible work. It's obviously very, very important to get our kids off to the right start. I was listening to the radio over the weekend, and they had a coach on there explaining to runners that 90% of the time, the first person to get over the hurdle wins the race. and really emphasizing how important it is to get off to a strong start, and that's really the greatest predictor of outcomes. And in that regard, this is just really incredible work that's so important in terms of equity, in terms of our future workforce, in terms of our economy, in terms of housing and environment. Everything touches this. And so I'm very excited by it. And I see we're leveraging a lot of partnerships, certainly in the nonprofit field. I'm looking forward to how this is manifested in the budget and anything that we can do as a council to help push forward these initiatives. And I would encourage our partners at the state and the federal level as well. We have a lot of opportunities to advance these issues. Maternity leave is a great example where we can really provide both parents options to stay at home and actually develop bonds with their children and have that time. Childcare, my goodness, how many people spend more on childcare per month than their mortgage? It's crazy. In terms of suggestions, I would say I speak to a lot of recent retirees or soon-to-be retirees. They're very skilled, very passionate. They want to contribute back to the community, and there's more and more that are retiring every day. And I think any opportunity we can use to ask all of these wonderful members of our community to step up and help solve this problem, I think that is it would be a tremendous help with advancing these goals. So thank you again for all this work.
Thank you.
Thank you. And Councilmember Glidden.
Thanks, Mr. Chair, and thank you to the mayor and to the committee and their co-chairs and Ms. Halsey for bringing this body of work forward. I know there's been a lot of anticipation about seeing the report and the recommendations to figure out what's the next steps. I actually just wanted to make sure I was getting clarity on some of the items that were in the report versus what may be some ideas for taking the report a step further. And I'm still making my way through the longer report. And so as an example, some of Mr. Beckman's suggestions, I just wanted to be clear, those were more some informal suggestions to us of how we might take things further, and it may suggest to me, is there sort of a next step in sort of convening stakeholders to get a range of suggestions of how would you actualize in terms of city policy on more of the short term versus some of these longer term recommendations, next steps. I just wanted to make sure I'm kind of tracking on what you think is taking us to the next levels.
Chair Gordon and Councilmember Glidden, that is right where we're at right now, is trying to figure out those next steps. And I think exactly what you said is correct. So the recommendations that we're bringing forward and that Mikkel Beckman mentioned, they are suggestions, they're recommendations. And at this point, we are trying to figure out how would we move them forward. And we would, welcome any ideas that you would have too about how we might be able to convene more people around this issue and how we might be able to move some of it forward.
Mayor Hodges.
Thank you, Mr. Chair. And I appreciate that question as well. That's part of what we're taking feedback on is, where do we go from here? The intention and sort of what has been put forward is much like with the Youth Violence Prevention Blueprint or other collective action or Heading Home Hennepin for that matter, is come together, build a set of recommendations, and then that committee or some form of that committee moves forward into implementation mode around the goals to then sit down, dig deeper, figure out what the best, what can happen more specifically, who would take responsibility for it, and how do we move the ball forward on the recommendations. And so the intention would be, once we have a final set of recommendations, to then move into implementation mode of one kind or another to answer just the kinds of questions that you all have been asking, which I appreciate and we're taking note of, so that, as we do move forward, we know we have both the suggestions and the questions.
Well, thank you very much. I appreciate all the work and the report that's gone in here. I think the goals look great. I actually am most impressed with goal 1. I think that might be the most important goal. In fact, to get to goal 1, you might end up having to actually have some stable housing involved and some quality child development happening. But I think that's really a key. A question that I have, I think, and my colleagues on the committee have, is which ones of these or which strategies are the city's responsibilities? I also want to look at how we can lead this, how the council can be engaged and involved and lead where it can. A couple thoughts came up when I was looking at the plan. One is, how long is it supposed to go to get implemented? You mentioned 2016, a few places in terms of some of the indicators, but that's right around the corner. And so think about, okay, and also if the cabinet's going to keep going on in existence, okay, how long, what would make sense? And maybe there's a touch point. This is definitely a never-ending goal. We're going to most likely and hopefully the planet will go on and we'll keep having babies and the city will survive. So, it could go on forever. But what I'm saying is, what's the time frame? Some of the goals are pretty vague, like increase birth weight. And we don't know exactly how much, and we don't know when we're going to check in on that. Some are more specific, 10% more screened, I think, per year. So that's something to think about. And this may be in the implementation part, so I don't want to get too far ahead of what you're trying to figure out by your final draft. But for us to see like a responsible entity after some of the strategies is really helpful. And it's hard to figure that out sometimes. Some of the strategies you have now, you even say you're going to recruit an organization to help lead on this. So that will be tricky. I really liked seeing that you tied into the governor's almost a similar 0 to 3 framework or that, and this is a chance maybe to get out of the gate a little first and influence that and bring some resources back. I'm not sure. The public awareness, I think, is important, and what's really neat is we're doing that right now, and you're going to do it again on the 3rd and the 5th with some more meetings, and the fact that we have this plan, I have to confess that 0 or prenatal to 3 has been pretty far off of the city's radar. I know the health department's been working hard on it, and I'm not trying to say that nobody's been doing anything, but it's definitely been, we've been more concerned, I think, with adolescence and early adulthood, justifiably so. There's a lot of problems that happen there, but the fact of the matter is the stuff that we can do down at the 0 to 3 is probably going to really move that further. So this is exciting. I'm very interested in it. For those who don't know, I've raised a few 0 to 3-year-olds and made it to 4, and beyond. But also I was involved in preschool teacher before this, and actually did some accreditation with the National Association, or validation they called it then, but anyway. So been very involved, and I think this will be key and want to help it move forward. So thanks for doing this, and thanks for giving your time to it, and everybody who's been on the cabinet for attending and being part of this. Hopefully the Health Department Youth Coordinating Board will stay involved in this as it moves forward, and hopefully this committee also can play an active leadership role in it.
Thank you very much.
And so I'm just going to move to receive and file this report. Any questions or comments on that? All those in favor say aye.
Aye.
Any opposed? All right, thank you very much. And now we'll quickly move on to our next item, which is our annual report from our Public Health Advisory Committee. And then after that, we'll take up the divestment resolution. And I believe we're going to have the co-chairs, Ms. Soderberg and Pelletier, going to make this presentation. You can take whatever time you need to get set up there. Thanks for being here. Oh, there you are. Look at that. That was fast.
Good afternoon, Commissioner Gordon and council members. My name is Karen Soderberg. I live at 286 Washburn Avenue North. I co-chair the Public Health Advisory Committee and represent Ward 7.
Good afternoon, Chair Gordon and members of the committee. My name is Jennifer Pelletier. I live at 1417 6th Street Northeast, which is in Ward 3, and I'm a co-chair on the Public Health Advisory Committee representing the University of Minnesota School of Public Health.
Welcome.
All right, I know most of you are here last year when I presented with our previous co-chair, but I just want to recap our responsibilities with PHAC. Really our role as a community membership or group to advise the City Council and the Health Department on matters that affect the health and well-being of the Minneapolis residents and the people who work in the city. So we work with the Health Department, review their priorities, and are kept up to date on their activities over the course of the year. And we also consider complaints from the public. We haven't had to do that in the last year, but I think our famous one previously was relating to recreational fires. and try to vet concerns of the community and give the council some advice on how to manage that. Before I go into what we learned this past year, I just wanted to remind this whole concept of community health, which I think was represented very well in the Cradle to K report. The health department doesn't stand alone as an island, either as a department in the city or within the community. And local public health intertwines with all these other aspects of our community, whether it be other public services or social supports, certainly the health care delivery system, but the commonly accepted figures that about 20% of a person's health is attributed to the healthcare delivery system and access to that care. That leaves 80% for all these other factors. And you've really gotten, I think, a good case story of that in the Cradle to K report. And so we try to, as an advisory committee, look at many of these factors, as many as we can, and prioritize them. And really, especially the last year or two, have been looking at these with a health equity lens, because we keep continually hearing reports about the disparity situation that affect not just the city, but the state as a whole, and what we can do as an advisory committee to help inform the health department and the city council to address those issues. So last year we had a pretty busy year with lots of learning items and a number of action items that Jennifer will go over. A big focus for us this past year was on breastfeeding, which really hits on this very, very early childhood development. And we had a number of speakers come in and share a lot of information and help us develop an agenda around that. We've also supported the Minneapolis Staple Foods Ordinance so that it aligns better with the women, infant, and children forgot what the C's are, subsidies. And we heard from the Minneapolis Youth Council about e-cigarettes, and also addressed to support legislation statewide to have an indoor smoking ban on e-cigarettes. And ultimately, we are settled at the city on that. And then we also heard a number of housing issues, which has created some new interest for us, and in particular had a talk about hoarding behavior and how that impacts very many aspects of the city, not just health, but also like first responders are severely impacted by that. And in fact, one of our new committee members is a first responder, so she was able to affirm much of the information we received on that. And then our final learning opportunity that we didn't take action on was to get an update on the blueprint for action to prevent youth violence, which remains a major concern for the health department. I'll let Jennifer refer to the priorities.
Thank you.
I'll switch.
So the way that our committee works is we identify some learning items and we get more information on these topics, and then we seek to take some sort of action to address those. So in the area of breastfeeding, which fits under the topic of school-ready children, one of the health department's goals, we received presentations from several groups to learn more about breastfeeding rates, supports, and challenges, as well as what programs and services the city already has to support breastfeeding families. And we also engaged representatives from 4 hospitals that serve Minneapolis residents in a panel discussion to share actions that their hospitals are taking to support breastfeeding. And as a result of all of this, we identified some knowledge gaps that we had in terms of cultural and structural barriers that cultural communities in Minneapolis are facing to continued breastfeeding. And so we've commissioned a study by a master's student at the University of Minnesota School of Public Health to investigate these issues and identify some potential areas of intervention, actions that the city could take. And that report is due out this summer. In the area of access to healthy foods, we gave feedback on early drafts to propose changes to the Staple Foods Ordinance. We also submitted a letter and public testimony in support of those changes, which were later passed unanimously. We also engaged the Minnesota Sports Facilities Association to discuss options for including healthy foods and beverages in the new Vikings Stadium and in their plans moving forward with that. Under the topic of smoke-free living, we wrote letters of support and provided public testimony in support of regulations at both the city and the state level for e-cigarettes. And we also supported the work of the Minneapolis Youth Congress and their recommendations for limiting youth access to tobacco products. Subsequently, this committee called for a public hearing to discuss the Minneapolis Youth Council's report, and the city passed an ordinance regulating e-cigarettes in indoor public places and places of employment. On the topic of housing and homelessness, we learned more about the relationship between housing, homelessness, concentrated poverty, and health impacts. And we heard presentations from the Institute of Metropolitan Opportunity at the University of Minnesota, as well as the Minneapolis Health Department. And we discussed city housing policies, funding, and development with the residential finance manager at Community Planning and Economic Development. And as a result of all of those conversations, we will be shortly putting forward a recommendation to create a City of Minneapolis Housing Advisory Committee, which would serve in a similar capacity to what we do in public health. And this ties in really well with the Cradle to K Cabinet's recommendations. And we see a real need for this more community engagement and discussion around how we're creating housing policies.
And finally, the last major thing we did is some administrative activities, which we have a subcommittee structure, and this is a committee I happen to serve on. So each year we help nominate and review nominations for the Public Health Heroes Award, and that's a nationwide recognition in early April each year, where we can, it's hosted by the health department here. You're all invited. I'm sure you'll get invitations. To just recognize throughout our community people who are contributing to the health and well-being of our city. We did some updates to our orientation manuals. We had a number of new members come in this year, and so there's a lot of housekeeping to help them get on board quickly. And just last week, we trained in 5 people, I believe, to help them understand our roles, what their responsibilities are, and how this fits into the larger context of the health department in the city, public health in the city and the state, and even nationally. And then the final task is to communicate with the council members on the activities and the key issues that we're addressing each year.
And we are in the process of finalizing our plans and agendas for 2015, but a few highlights to share with you right now. We will be providing written and oral feedback to the Cradle to K Cabinet report from the committee and also as individuals. And we're planning viewings and community discussions around a documentary called The Raising of America, which addresses how to create nurturing environments for healthy child growth and development. So it also ties in with the Cradle to K topic. As I mentioned, we are drafting a recommendation for the development of a housing advisory committee. And we continue to review our priorities alongside the health department's goals to identify additional areas of overlap where we can work. And we are engaging council members, community members, and partners to discuss their health concerns and priorities for Minneapolis. And we invite you to share any of your priorities with us as well. And with that, we will answer any questions that you have.
Well, thank you very much. I noticed that you mentioned the Public Health Heroes, and can community members nominate people for a Public Health Hero? Because I do know that the nominations are open until March 6th, so people could actually be nominating a community member or a local organization that's focused on making Minneapolis a healthier place right now or this week. Council members can make nominations, or anybody out there could as well. So I just wanted to let that be known. And I think there might be some other questions and comments. Councilmember Johnson.
Thank you, Mr. Chair. And this is in particular related to 2015 and kind of some of your priorities and just some feedback. So something in my ward that's particularly important to residents and as well is important to some colleagues' wards and their residents, and overall about probably half, if not most of the city, is airport noise. So the airplane noise that we hear and what the health impact is. And oftentimes we're, talking about noise as an annoyance, right? And you're sitting in your backyard and you can't carry on the conversation until the plane passes by. But my understanding of a number of studies is that they've linked this noise to actual cardiovascular effects and heart disease and things like that. And I think we'd like to have more information on that and more of an analysis and a better understanding of noise pollution in general as a health issue and what perhaps the city council could do to address some of these more common or more egregious sources of noise pollution. So that would be my feedback.
Councilmember Gordon, Councilmember Johnson, that has come up in our priorities discussion in the past, not simply airport noise, but localized noise due to whatever it might be. For example, Prospect Park was in the news not that long ago for their new sound barrier along I-94, and one of our members has brought this issue up around the Cedar, the establishments on, I can't remember exactly the intersection, Whiskey Junction area and all that, and the impact that really, at times of the year, the sound extends very far into the neighborhoods. So it's definitely an issue that is on our list. It hasn't floated to the top, but it's, it's there for discussion.
One thing I did want to mention is that the committee's developed kind of a work plan, and definitely a lot of those are issues that the health department is going to bring forward. And I'm interested in having an opportunity to meet with the advisory groups that report to this committee too, to try to kind of share and incorporate the goals and things you want to accomplish. I really appreciated seeing your priorities. I think it'll be very interesting. I'm thinking of even the breastfeeding one. I don't know that we have any accommodations in City Hall or any of our city buildings to actually support that in any way whatsoever. I suppose there's break rooms and people have their offices and things like that, but I think that that's interesting. I'll be looking forward to that. And this housing advisory group is very intriguing to me too. I know that we have kind of a staff entity of a rental housing advisory group, so you might want to look into that and talk to Reg Services about who's on that, the various stakeholders in that group. But that's intriguing to see how we could tie that in. One thing I did want to toss out, kind of along the veins of something out of the blue that we care about, but is air quality, because the city has been engaged in this study of rather localized air monitoring for the last year, and the reports are going to come out this year. So it might be interesting to get you to look at that or brush up against it or see if committee looks at that. There could be responses we could make in terms of localized problems or other issues like that. There's also a chance where actually the EPA is going to change their standards and we're going to find out that we no longer have healthy air at all, but we'll see how that goes. And if that's the case, then we're going to have big consequences to prove we can clean up our air. So it'll be more dramatic, but at any rate, I wanted to put that on your radar. I don't see any other comments or questions. So just thank you so much for your service. The functioning, attentive, and engaged advisory groups really do make a big difference for me and my work, and I think for the whole city council and the city. So we really appreciate the investment of time and energy and attention you put into this. Thank you so much.
Thank you.
Thank you.
So I believe that brings us to the next item. Item number 6, and I'm going to turn the chair over to Councilmember Johnson for this, because item 6 is my item, and I'll let him run this, and I'll be back with you for item 7.
Great, thank you much, Councilmember Gordon. So item number 6 is a resolution committing to continued divestment from fossil fuel companies. I believe what we're going to do is hear from Councilmember Gordon and then open it up for some public commentary. So with that, Mr. Gordon.
Thank you very much. Yeah, I just thought that I could explain a little bit about what this is and why I'm proposing to do this. It's a little unusual. There isn't a staff report with it, but this was an initiative that I brought forward, and I thought that I could just present it here. As you said, this is a resolution that would make it city policy not to invest city funds in fossil fuel extraction companies and also encourage others to do the same. If you'll notice, the resolution also says if they can't do that, we're also encouraging them to at least provide alternative choice in investments. This is something that Minneapolis residents have actually come forward and asked me to do and adopt this kind of resolution. It's connected very much so to climate change and avoiding the most devastating impacts of climate change. Companies that extract fossil fuels already have reserves 5 times the amount that would exceed what we think is it all safe in terms of the emissions. There's, I guess, different numbers that people have out there, but it's really important that we hold these global emissions down, and we have already found enough fossil fuel to exceed them dramatically. And also, this backs up and reinforces our goals for carbon reduction. As you probably recall or know, we want to reduce our emissions 30% by 2020 and 80% by 2050. Also, the Minneapolis employees don't have this option available to them at this time to choose a fossil-free investment pool. Part of this is also joining an international movement. There's already 37 cities that have done these disinvestment policies, and also many religious organizations, foundations, and some colleges and universities. My hope is that this will encourage others to do so. Also, it doesn't actually require any change to current practices. Talking to our finance department, we have no investments in fossil fuels now. This is also based on precedent that was set when we divested from South Africa in 1985 and the Sudan in 2008. And it doesn't include any financial risk to the city. I just want to emphasize this is aimed at the extraction and refining companies only, and doesn't impact our clean energy partnership with our utilities. And in fact, if people would like a list of the 200 fossil fuel companies, it's published and it's well known. So that's kind of enough introduction. I'd be happy to take any questions or anything if anybody has any.
Anyone have any questions or additional comments to make? All right, well, with that, while this is not an official public hearing, we'd like to open up for public comment just to hear from some of the voices in the room on this. I would say please try to limit it to no more than 2 minutes, and try not to repeat some of the other points that others have made. But with that, we do have Dwight up first. And then after that, Terry.
Good afternoon. Thank you, Chair Johnson, members of the committee. I'm Dwight Wagenius. I live in the 11th Ward at 4804 11th Avenue South. I'm here today on behalf of Minnesota Interfaith Power and Light. We're an interfaith organization and have member faith communities and affiliate networks throughout the state. I'm co-chair of the board and lead the divestment investment team of the Interfaith Power and Light. Our central office is in Minneapolis. I'm a member of Mayflower UCC in South Minneapolis. We support the resolution. Your resolution, as drafted, demonstrates your knowledge of the problem stated in scientific and economic terms. Thank you. The obstacles to solutions is the fossil fuel companies that use their incredibly large wealth and power ruthlessly to continue their business plan and the lifestyle it supports. The device to stop them is divestment and reinvestment. We do not see divestment as an economic tool. These companies are too big to directly damage economically. It's a moral tool. We seek divestment because it is wrong to profit from destruction of the earth. It is wrong to retain fossil fuel company ownership in our savings, pension, and endowment funds. The investment research you cite in the resolution shows that it is also a mistake to continue to invest in the carbon bubble long term. That removes the risk alleged so often in opposition to divestment. Successful divestment reinvestment requires individual action and the cooperation and coordination of major public institutions, faith communities, colleges and universities, and units of government, starting with you. You're modeling good behavior. Thank you very much. This is an important thing that you're doing. Do the right thing, pass the resolution, and declare the city's continuing support of divestment and reinvestment. We will be allies in the struggle. Thank you. I stand ready for any questions.
Thank you very much. All right, we have Terry, followed by Richard. And if you could please just state your address as well. Thank you. If you could state your address as well, that'd be great.
Thank you. My name is Terry Hokinson. I live at 3352 Prospect Terrace in Prospect Park. I'm here to speak as a board member of Minneapolis Interfaith Power, or Minnesota Interfaith Power and Light, and I wholeheartedly applaud the wording and intent of the resolution and endorse my co-board members' statements, so I have less to say. I like to think of Interfaith Power and Light as a faith utility. I don't think faith is real unless it is lived. And living my faith means caring for creation, which includes my fellow creatures and the earth we all depend upon for life. Living my faith means facing the inexorable fact that we have to stop burning fossil fuels if the livability of the planet is to be preserved. We're already in big trouble, but we've got a chance to pull back the heavy curtains of doom that are closing on many species of living beings, including human beings. Divestment from fossil fuels is a moral imperative. It is a practical possibility. For the love of God, for the love of creation, for the love of our children and grandchildren and generations yet to come, let's do it. Thank you.
Great, thank you. We have Richard, followed by Siri.
I am Richard Barnes. I live at 1721 University Avenue Southeast, and I'm a student at the University of Minnesota. And others have and will speak to climate as an impetus for action and for divestment. I wanted to remind us, as you brought up earlier, Mr. Gordon, that Minneapolis ranks 42nd of 235 metro areas in the nation for air pollution. We're not doing too well in that regard. We're also 40th of 520 cities in racial disparity in the effects of air pollution. And that means essentially that nationwide 40% people of color are exposed to 40% more air pollution than people who are not of color, and that's true in our metro area as well. Divesting from fossil fuels is one way to move towards resolving both health issues and issues of racial equity. And for that reason, I would support this endeavor.
Thank you. We have Siri, followed by Nancy.
Hello, my name is Siri Simons, and I live in Ward 9 at 1211 East 35th Street. So I'm here today to support this resolution to endorse divestment from fossil fuels, and I personally care about this for a couple of reasons. The first is that I'm a former City of Minneapolis worker, and I have investments through Impera. I would like to see my assets divested from fossil fuels because I think that they will contribute to climate change, which will have negative implications as early as my retirement in 2055. Second, I think that you are the right people to make this decision. So as a student, I was involved with the Beyond Coal campaign at the University of Minnesota, which was an effort to move the University of Minnesota off of coal. This council passed a resolution in 2010 supporting a carbon neutral campus. That was a huge help to our campaign, and the university announced that it would go coal-free the following year. So while this may seem like a symbolic gesture, I think that it's really important and could have real impact on the divestment movement. The third reason why I think this is important is I work with students for an organization called HECUA, and they have been working tirelessly on the divestment campaign, making phone calls, organizing an intergenerational base of support, and meeting with some of you. So this is a great opportunity for the city to show young people the power of participatory democracy, and also that Minneapolis cares about a sustainable future. So I ask that you support the resolution. Thanks.
Thank you. We have Nancy, followed by Ruth.
Hi, I'm Nancy Kent. I live in Southwest Minneapolis at 4400 Upton Avenue South, 55410. And just, I don't have anything more to add, but thanking Councilmember Gordon and Cano for a very well-written resolution. Just very, makes all the good points, everything that needs to be said, and that I'm just very proud to be a citizen in a city that will be and has been model for the rest of the rest of the city, like the university and also the rest of the country. Thank you.
Thank you. We have Ruth, followed by Simone.
Dear city leaders, a century ago, when my neighborhood was being developed, Bryn Mawr was considered the remote western outskirts of Minneapolis. There were still working dairy farms in Kenwood and in Bryn Mawr. How impressive that even back then, our city leaders had the foresight and the vision to be planning the jewel of our park system that we're so famous for today. How grateful we are now. I'm hoping that a century from now, future residents will still be able to look back with gratitude. I'm hoping they can still treasure the clean air, water, and wildlife, that Minneapolis still has the climate that, for all its rigors, we can embrace and thrive in. The fossil fuel economy is a bubble on the brink of breakage. It is simply suicidal to ignore catastrophic climate change. I urge you to turn this crisis into opportunity. Clean, locally sustainable energy creates jobs. It keeps us more secure. Please resolve that our public portfolio will not invest in fossil fuels. We have all been part of the problem. Let us now be part of the solution. Thank you.
Thank you. Simone, followed by Andy.
My name is Simone Childs Walker, and I live at 2412 26th Avenue South, 55406, member of Ward 2. I am also a student at the University of Minnesota and a member of Fossil Free Minnesota, the student organization that has been working to divest the university's endowment from those same 200 fossil fuel companies for the last two and a half years. When I joined that movement 2.5 years ago, it was the first time that I, as a young person whose coming of age was largely defined by learning about climate change and its current and potential future impacts, could be part of a solution that was really addressing the problem on the scale that it needs to be addressed. When I started working on divestment, I had no idea that I would be in front of a microphone, in front of a student audience, meeting with President Kaler of the University of Minnesota, let alone standing here, speaking in front of my city council. And so thank you for bringing this resolution forward, giving me the opportunity to speak here on behalf of myself and on behalf of students at Fossil Free Minnesota and the university. And just wanting to say that this movement is empowering. It's empowering for me, it's empowering for students here in Minneapolis, all over the country, all around the world. It's empowering because it's a movement, because we are working together, because young people are uniting around this issue in a way that they never have before around climate. Second of all, divestment is working. We're already seeing changes in the market, responding to institutions, individuals who are choosing to divest, moving our economy away from destructive fossil fuel extraction towards renewable, sustainable choices. And third, it's the connections that are being made in this movement that are empowering for me and empowering for students. Again, being able to stand here and testify in front of you, council members. So I want to say again, thank you, and to say that I and Fossil Free Minnesota support this resolution, and to ask you on behalf of students at the University of Minnesota to support this resolution in support of divestment. Thank you.
Thank you. We have Andy, followed by Patty.
Thank you very much. My name is Andy Pearson. I live in East Phillips at 2629 18th Avenue South, number 2, 55407. And I'm an alum of the University of Minnesota and involved with the Fossil Free Minnesota campaign that Simone is part of, so I'm not going to speak to that because she just covered it so well. I wanted to tell just a thought or two that I was having earlier today, listening to the wonderful discussion that was happening here about how we're caring for those who are the youngest among us and the most vulnerable. And in a way, I think we can see investing as placing a bet. And you can place a bet on a lot of different things. You can place a bet on the past, you can place it on the future, place it on all kinds of industry. What an investment in fossil fuel is doing right now, unfortunately, is placing a bet against a livable planet. Because if these investments in the top 200 fossil fuel companies make money and do well, it means by definition that we're extracting more carbon than we know that the Earth is able to handle and maintain a livable system. So when I see folks like Siri up here, who's a young person who's testifying and who's saying she has investments through the state of Minnesota, which this could be a leverage point on, I think it's too bad that the money that she has to be used to directly bet against those who are youngest among us. I was born in Minneapolis. I've lived here much of my life. This is a city that I love, and I love it because I feel so often when we are put in maybe hard places or hard decisions, we do make the right choice, and we do think about those who are yet to come. And I'm so confident that we can do that today. I thank you all so much for your leadership. Let's do this.
Thank you. Patty, followed by Emily.
Hi, my name is Patty O'Keefe. I live at 8113 Virginia Circle North, St. Louis Park, Minnesota. I lived in Minneapolis when I was going to school at the University of Minnesota and plan on moving back, but right now I'm living with my mom to save some money. Just wanted to say that so you know. So I work at Minnesota 350. I've worked there for the past 2.5 years now. And so I have seen the divestment movement grow from the beginning. So in 2012, there were 3 divestment campaigns on college campuses. Now there are over 400 divestment campaigns on college campuses just in the US. So that's not even counting all the activity in Australia and Europe, as well as Asia. So that's an incredible amount of growth within just a couple years. And actually, divestment has quickly moved off campus to municipal and state levels, as well as individuals who are looking to divest their own funds. Some cities that have made similar resolutions to the one that's being proposed today are Boulder, Seattle, San Francisco, Oakland, Providence, Madison, Ann Arbor, Santa Fe. So some pretty large cities. And then there have been over 65 religious institutions that have divested, including a couple entire denominations, national denominations. And the total amount that has been committed to divestment is $50 billion. It's approximately $50 billion. So we're talking about a lot of social capital, but we're also talking about a lot of financial capital that is going into the new economy that is not dependent on the fossil fuel industry, that currently has the social, political, and economic clout to ruin our atmosphere through its business practices, which is not okay. So I think that this is a really exciting time for Minneapolis to join in as a city. I personally feel like this is a pretty low risk, high reward commitment. And yes, this is symbolic, definitely. And so was Rosa Parks sitting at the front of the bus and taking down the Berlin Wall. And I think that we need a lot more symbolism around climate action right now. So I appreciate your time. Thank you.
Thank you. All right, we have Emily.
Hello, I'm Emily Moore. I live at 4055 Colfax Avenue South in Ward 10. And I'm a member of, we're calling ourselves Divest Minnesota. We are pension holders from state employment, municipal employment, and well, there's a third one, AFSCME, of course. We have been meeting for a long time, and so we know a lot about divestment. And the thing that I feel compelled to comment on here today is that Minneapolis, our mayor and you are embracing the Cradle to K cabinet and the resolution, the recommendations. And as you heard earlier, you're getting feedback on that. And it's so commendable. I really, really appreciate that work. And if you could look at that and align it with this resolution and recognize that they're two of the same, they're moving in the same direction. They are both for our children's future. And these children that you are funding programs to help them succeed in school and in life also need to have some help to combat climate change so that they will have a future. Thank you so much.
Thank you. Is there anyone else who would like to speak? Anyone else? Any lobbyists from the oil industry? No? No? All right. Well, with that, do we have anybody interested in making a motion? Councilmember Gordon.
Thank you very much. So I will move the resolution committing to continue divestment from fossil fuel companies and calling on our partners to divest.
The resolution has been moved. Any discussion? Any discussion? Seeing no discussion, all those in favor, please say aye.
Aye.
All those opposed? The motion carries. Thank you. Thank you. Right. And I will now turn it back over to Councilmember Gordon.
Well, thank you very much. And so that'll go forward to the full council for final approval at our next meeting, which I believe is March 20th. And we have one more item left on our agenda today, which is the work plan discussion and the presentation. And I'm going to ask Peter Ebnett to come up and make a presentation, and everybody should have a little colorful sheet of paper in front of them, which is the draft of the committee's work plan. Welcome.
Thank you. Good afternoon, Chair Gordon, committee members. My name is Peter Ebnett, and I'm a management analyst in the clerk's office. I'm here today to give a brief synopsis of committee work plans and an overview of the process undertaken by your committee. Committee work plans are a tool to help highlight, monitor, and execute the policy priorities of council committees. Council Vice President Glidden initiated the process and helped guide its development starting in late 2013, based on a similar system in the city of Seattle. The work plans focus on high-level, major policy priorities of the committee chair and committee members. They are intended to help guide the business of the committee and increase transparency and accountability. The idea is that residents, public and private partners, city staff are made aware of the goals of the committee each year and then are able to monitor the progress throughout the year. The Health, Environment, and Community Engagement Committee, with the guidance and support of Chair Gordon, was the first committee in 2014 to undertake the process. In February of 2014, Chair Gordon, along with Vice Chair Johnson, held a meeting of all department and division heads who report to the committee, along with representatives from other committee members, to share ideas, assess goals, and create a tentative timeline. A draft work plan was produced and utilized throughout the year. Quarterly policy meetings were also held to track progress and make updates. At the start of this year, recognizing that many of the goals from 2014 were accomplished, the same group was reconvened, new objectives were added, and a few incomplete items were carried over. This is the list that you see before you today. The plan this year will be to use these quarterly meetings to check in on progress and make any necessary updates. The list is not intended to be comprehensive. It's a living document, and it will likely look different by the end of the year. It is Chair Gordon's plan to issue a report at the end of the year summarizing the work of the committee. That concludes my prepared comments, and I'm happy to stand for any questions.
Thank you very much. And just a note to committee members, this is a work in progress. Your policy aides were invited and are invited, and we could potentially have up to 3 of us at any of these quarterly meetings when we look at this. Bringing it to the committee was really an effort to kind of make sure everybody was aware of it and make it a public document. But if you have ideas and things you want to add and work on, you can bring those to me or forward at any time. I don't see any questions or comments on that or any changes or tweaks, so I appreciate that. This helps, I think, me do my work, and hopefully it will help the committee do their work as well. And if you see anything on here as you look over it later and you want to ask about or talk about, go right ahead. Oh, yes.
Yes, sorry, I do have a question. Well, maybe more of a statement. So I just wanted to give folks a heads up that we, in the sustainability section, where we talk about the Climate Action Plan implementation update, it's really important for us to figure out how to move the green zones conversation forward because the community's talking about it. I know that last year my office engaged sustainability and met with Brendan Slaughterback from that department, and they really expressed being really weighed down by the Clean Energy Partnership responsibilities and tasks. And so as we know, we have added a new staff member to that office, and I want to just bring attention to the fact that that conversation has been talked about in the community with different organizations. The Green Zones discussion. I know that State Rep Karen Clark is looking at this at the state level. I think we as a city can play a strong role in this and acknowledge the fact that there are clusters in our community that have an overburden of pollution, and they tend to be some of the most low-income communities in our neighborhoods, and so we know that they often don't have that much role to play in what pollution gets exerted into the environment, and it goes. This is a conversation that's connected to the environmental justice issues in our city. I also just wanted to make a note about the NCR report on the ADA policy and the limited English proficiency plan. And again, my office has been working with communications and NCR to really figure out how to move that responsibility out of NCR's purview. It's inappropriate for a communications task to be in that department. It's taking away attention from the ways that NCR could be helping our neighborhood associations perform its job better of doing community engagement with our neighborhood associations in the ways that that should be warranted by the monies that we give them. So I acknowledge that the two are connected. Communications and community engagement are connected, but they're not the same thing, and they shouldn't be housed in the same department. So those are just two comments I wanted to kind of flag for everyone.
Can I just ask, did you say the limited English proficiency and the ADA policy both?
Yes.
Okay, appreciate that. All right. Anybody else want to make any comments or anything? Then I think we're prepared to move this. I'm just going to receive and file this. All those in favor say aye.
Aye. Aye.
Opposed? Thank you very much. And I believe that concludes our business before us, and so this meeting is adjourned. Thank you very much, everybody.